In 2020, 65 years old people and over were 1/5 of the population, and this population is projected to increase by 50% in 2040. The number of very old persons, the share of very old persons, so above 80 years, is projected to increase by 2.5-fold by 2100. So these numbers means that 20% of the population is older in the European Union, but this also means that 1/5 of the population, older population, covers 2/3 of the beds, and that 20% of the population also means that we are in a super age society. As in the definition, the common definition, an aging society is that one in which the proportion of older persons reach 7%, and we already have 21%. So in the World Health Organization predicts that by 2035 we will have 14 million geriatric patients with cancer. Now we have to understand that all geriatric patients are older patients, but not all older patients are geriatric patients. And to understand these differences and to look at these differences between older and geriatric, functional loss and vulnerability, there is a cornerstone in geriatric medicine, which is the comprehensive geriatric assessment. An important thing is that we can and we should always define the differences between biological age of our patients and their chronological age. So what we wanted to do, and thanks to Onco-Aging and the EUniWell, we were able to do and to perform 3 videos with 3 scenarios of biological age, the same chronological age, but different biological ages in these 3 scenarios, in a way that it's possible to understand why tailored interventions and co-managements between geriatricians and oncologists and also multidisciplinary teams are so important in this super-aged society. Thank you.
Mrs. Landers? Mrs. Landers?
Yes, that's me.
Nice to meet you. My name is Sophie Norris and I'm a medical student. Would you like to follow me to meet your doctor? Oh, you need some help?
Mm-hmm.
Yeah, like this.
Good morning, Mrs. Landers. I'm Dr. Smith, the specialist assigned to your case. How are you feeling today?
Well, actually I'm feeling terrible. I have this pain in my knee.
Oh, I'm sorry for that. But do you know why you're here?
Yes, I think so.
Can you tell me why you're here?
I'm here because I have this pancreatic cancer.
My colleague told me about that and sent you therefore to me.
I feel it's hopeless. I feel like I'm going to die anyway of this.
I can understand your feelings. This information must be a big impact in your life. Look, Mrs. Landers, Dr. Fischer sent you to me for a reason, and he told me about you. And actually, you're here because we are a specialized center for that. So you know that there are many opportunities opportunities to treat you. And as Dr. Fischer told me about you and about your history and about your situation at home, and especially about the situation and your early disease of your husband, you have to trust me that we want to help you, and we hear that we can help you.
I don't trust doctors very much.
I can understand that. So, but let me make it clear and that we are here to help you. Yeah, and especially when I talk to your to Dr. Fischer, who is your family doctor and who knows you for a long time, we both think that an operation would be the best option for you, especially because your disease is in a really early stage.
I don't want an operation. I'm too old for this. I don't want an operation because what if I don't make the recovery?
Look, as I told you, that what I can see, you're not in such a bad condition. And in all the cases, what we can do, we think, and I think, that an operation would be the best opportunity for you.
Are there any other options?
There are other options, but as I told you, the operation, and I would just like to explain you how the operation would look like, is, because it's in early stage, the best opportunity for you. Yeah, take your time. As I can show you maybe on this picture how the operation looks like, the tumor.
I can't look at this right now.
Okay, no worries.
I need more time.
No worries, I can understand that totally.
I cannot decide right now. I do need more time.
Okay, Mrs. Landers, I totally understand that it's a hard decision, for sure. But to make it clear, the disease is still in a really early stage, so you have the option, or there is the opportunity that it's potentially curable. So therefore, I think that the operation is still the best choice for you, because as I told you, I think, and that you're not in such a bad condition, and that after the operation you have, or you can have, a fast recovery actually. But if you need more time, and what is totally understandable, there is also the opportunity to make the diagnostics which are still necessary. So, and we have the option to have a geriatric assessment, which means that with the result of this assessment, to see how the operation, the surgery would impact your body and impact your recovery, to see that better, because then we have more time. And if you think, or if you need more time, we could have then the appointment, and after that appointment, 2 or 3 days later, we could talk again, and then with all the results we can make maybe a better decision. What do you think about that?
I guess so.
Yeah, so let me do all the appointments which are needed then, and then we will see in some days again, and we can talk again about that. Yeah? Okay.
Mrs. Landers,
Yes, that's me.
Nice to meet you. My name is Sophie Norris and I'm a medical student. Could you follow me to meet your doctor now?
Yes. Is it far?
No, it's just around the corner.
Okay.
You need some assistance?
No, thank you. I can manage on my own.
Okay.
It's okay.
Good morning, Mrs. Landers. I'm Dr. Smith, the specialist assigned to your case. How do you feel today?
I just think it's terribly cold.
Yes, the weather is horrible. Mrs. Landers, do you know why you're here?
Yes. I'm here because I was diagnosed with this pancreatic cancer.
That's right. That must be a shock for you.
Yeah. It came totally unexpected. I still haven't accepted it, really. I hardly had time.
For sure, it was nearly 1 week, but look, Ms. Landers, I talked to Dr. Fischer, your family doctor.
Yeah.
He who knows you already for many years, right? And he told me about your case, and he also told me about your plans that you want to travel next year, right?
Yes, I do have plans, but actually I heard that many people die of this cancer, or that they don't make the operation. So I don't want any false promises. I really would like you to be honest with me. What is my prognosis?
Look, I really want to be honest with you. So, pancreatic cancer is a severe disease, and often it is associated with a bad outcome for the patients. But actually, if we see your case, maybe as also Dr. Fischer told you, we diagnosed this disease in a really early stage, and he brought you to us, sent you to us for a reason, because we are a specialized center for that. And we both think that the best option for you would be an operation, because you're in a really good condition. So,
Well,
if I can just explain you how the operation would be.
Well, you know, I don't understand why this is happening to me. I've always taken good care of myself, I thought. So, is this operation really my only option?
I think, to be honest, it's your best option.
Well, then, what are the next steps?
Actually, we have to complete the diagnostics. So that means to make some CT scans, MRI, and some blood tests. And then after that, with all the results, we would bring that to our so-called tumor board, where specialists from many different departments participate and who would confirm the procedure, which means the operation, actually.
Well, if you say that's necessary, I guess. Okay.
It would be, and just remember that I'm here always to answer all your questions, and that we will do everything together.
Yes, because, you know, I really still have plans. I have things to do, people to take care of, and yes, I do want to live.
And we want to make everything possible that this can happen. So, if you don't mind, I would just call our medical student to take some blood. Yeah? Okay.
Mrs. Landers,
Yes, that's me.
nice to meet you. My name is Sophie Norris and I'm a medical student. Would you follow me to meet your doctor, please?
Oh, of course. Hang on just a second.
Of course.
Just wanted to tell you that the view is really nice.
Yeah, especially when the sun is shining.
Yeah, not today.
All right, this way, please.
Yes.
Good morning, Mrs. Landers. I'm Dr. Smith and the specialist assigned to your case. How are you feeling today?
Well, that's it. I have knee pain.
Okay.
But apart from that, I'm, of course, worried about my condition.
I can understand that. I talked to your family doctor.
Dr. Fischer?
Yes, that's right. So you're familiar with your diagnosis?
Yes, I am.
Can you tell me what your diagnosis is?
Of course. I was diagnosed with pancreatic cancer.
Okay, right. And Dr. Fischer also told you that we are lucky that it's in an early stage of the disease.
Yes. And there's something I wanted to ask you about.
Okay.
I need my glasses, but okay. I found this article
Yeah.
about transplantation after pancreatic
Okay.
cancer. And I want your advice on that.
Okay, I'm glad that you read already about that, but transplantation is an operation we of course offer, but in your case it doesn't work. So in your case we would do another operation. We would do a resection of the tumor out of the pancreas.
Yes, I believe I read about that too. Well, when would it be possible to get an appointment for the operation? You know, I do plan to make a speedy recovery. I know you can't force these things, but I've got some travel plans for next spring. My son is getting married in New Zealand, and I'd really like to be there.
Oh, that's really nice. Yeah, actually we have to do some we need to complete some diagnostics, so we need to do one more CT scan, MRI and so on. But afterwards, I think if you want, we can make an appointment quite early from now to do the operation.
Yeah, actually that would be a relief. You know, everybody's worried, I'm worried, my family is worried, and so maybe if we have an appointment for the operation, we can all calm down a bit.
I hope so. Yes.
Yeah, me too.
Do you want me to explain you some or give you more information about the operation?
Well, it scares me a bit, but go ahead. I can take it.
So as the tumor is in this area of the pancreas, there are different approaches we can offer you. Yeah. And first of all, we have robotic surgery.
I want to ask you, I heard about it, that it's very safe, but are there only machines or will there be people too? I mean, will you be there?
Of course, I will do the operation, and the robotics is just an auxiliary instrument to help me during the operation. Yeah. And there are other approaches we can offer. For example, the laparoscopic surgery, and of course the open approach. And as you are in a really good condition, what I can see,
glad to hear that.
We have all the opportunities we can offer. With all the results we get, we will bring that to our so-called tumor board, where specialists from different departments participate to confirm the way we want to operate you then.
Yeah. Since you say I'm in a good condition, other than the cancer, let's do that.
So, but I have to admit that, of course, every kind of operation has its own risk, and of course, it's a big operation with different kind of risk. We have to think about.
I'm aware of that, and it scares me. But I have a great family, and I think they will support me during recovery. I have friends who can come visit me. And all this actually gives me a reason to stay positive. And also, I trust your expertise.
I'm happy to hear that.
And your experience.
I'm happy to hear that, really. And be sure, remember that if you have any questions, I'm here, and that we will do all the steps together. Yeah. And if you don't mind, I would just call our medical student to take some blood.
Okay.
And go further then with the next steps.
Okay, then let's do the next steps.
Okay, thank you very much.
Yeah.
So on the one side, we today want to develop programs to early diagnose cancer and also to prevent cancer. But on the other side, it's very important to develop programs, educational programs for the future to treat elderly patients that have cancer, because it's different than when we treat young patients. A key challenge for cancer patients at old age is the perioperative management and in particular postoperative management of complications. Here all disciplines have to work together. It's not only surgery, but it is also the geriatrician, it is the anesthesiologist during the operation, it is the oncologist after and before the operation, the radiation oncologist, and nursing, of course, and rehabilitation teams. So for the surgeon, in particular the geriatrician, since we operate mostly on old patients that have developed cancer, it should be the best friend. For all young medical students and all young trainees in medicine, I think it's really important for you to take this message that geriatric assessment of cancer patients at old age is really important for surgery, for radiation oncology, for oncology, and this interdisciplinary setting of treatment of these patients suffering from cancer.